today I'm doing a follow-up with Dr. Vladimir Sinkov. He has relocated to a new practice and he's going to tell us about that, as well as what it's like to market a new surgical center, and be a fresh new surgeon in a new market. So, Dr. Sinkov, take it away.
So obviously, I had to start my career here all over. I joined a orthopedic specialty group, just like I did in New Hampshire.
And do you see similar conditions or do you treat like similar cases with patients?
Oh yeah, no. In terms of what patients have, it's basically the same thing. My practice is mostly adult degenerative spine conditions, stenosis, spondylolisthesis, disc herniations. Basically, your basic set of adult degenerative conditions. Not really different. I haven't really seen much difference in the way patients are.
Do you say there's a difference in the attitude of the demographics there? Like as far as, embracing the procedure or being kind of fearful? Is there any difference?
Not necessarily fearful. They seem to be. I guess it's more of a. I'm in a more of a major metropolitan area. I'm in a group of 18 orthopedic surgeons. There are three other spine surgeons there, and I joined them. The practice is growing. They have more patients, so they had a need for another spine surgeon. Really, each physician runs their own independent practice. So I don't really tell them what to do. They don't tell me what to do. Basically, patients come in. They either get scheduled with me or get scheduled with other spine surgeons. If I see them, I basically give them what I offer. They see what they're. So basically, more work in parallel, not necessarily together.
Interesting. So what makes you different from other spine surgeons?
One thing I have developed in New Hampshire and kind of came here offering is minimally invasive spine surgery. The way I do that, truly minimally invasive spine surgery, especially with computer navigation, not that many spine surgeons in the United States do. The latest study showed that only about 10% of spine surgeons in the United States do that. So when I came out of training back in New Hampshire, I got trained in all the regular spine surgery procedures, but not really the new minimally invasive procedures. The market I entered back in New Hampshire, there was already several spine surgeons in there, actually just one group, but with several spine surgeons in it that already were doing minimally invasive procedures. So I thought, well, just for the sake of competition, I need to learn them. I started looking into them, into the minimally invasive procedures. There are actually a lot of studies showing that they're a lot more beneficial to the patient. So over my first 2 years of practice, I slowly transitioned, basically taught myself how to do the surgeries in a minimally invasive fashion, which is basically less damage to the patient's body while achieving the same surgical goal. So you result with less blood loss, lower chance of complications, faster recovery, less stay in a hospital. So when I transitioned for example, lumbar fusion patients, instead of staying in the hospital 3 to 5 days, went home the next day. Blood loss became a lot less. I haven't really did a blood transfusion on a patient in several years now because they just don't have enough blood for me to even need to do that. Infection rates are lower. They have a lot less pain, so they take less pain medications post-operatively, so they don't get all the potential complications of taking the pain medication. So I slowly developed into doing this minimally invasive spine surgery practice in New Hampshire. When I moved here, I started offering that. I kind of assumed that in Las Vegas being a large metropolitan area, there will be actually more competition in terms of other spine surgeons offering minimally invasive procedures. Surprisingly, there are not as many. In terms of what spine procedures are done in the Las Vegas area, the surgeons seem to be a little bit more conservative and doing more traditional procedures. So I basically very quickly realized that would be a nice niche way to market myself and at the same time promote doing minimally invasive procedures. Not only do I market myself, I actually teach other surgeons how to do those procedures. I give talks on minimally invasive procedures. I'm trying to promote it because I have seen how much better it is for patients in general. My feeling is eventually 10 years from now, that'll be basically new standard of care in spine surgery, just like general surgery over the past several decades has transitioned from big incisions and a lot of invasiveness to mostly being done laparoscopic with cameras through small poke holes in the skin. So spine surgery is going through that same evolution right now, and I'm trying to promote that. And obviously, the more spine surgeons I kind of recruit to do that, the easier it is to get the companies to develop new devices that are minimally invasive and new procedures and new instrumentation. So I do that, and obviously, to me, it's good. I get to market myself that way. Pretty much every patient, when you tell them, well, would you like a big open incision, lots of pain and lots of blood loss, or would you like several small incisions, less pain and quicker recovery, faster going home? Obviously, every patient picks that. So
Yeah, wow.
Easier to market myself.
Wow. That's pretty cool. So where do you see yourself in a year from now?
Hopefully busier than I am right now. Right now, basically, well, I'm fairly busy. There's already fairly steady flow of patients. I'm not struggling as much as I did in the first 6 months of my initial practice back in New Hampshire. I joined a group that is already very busy. They already had a lot of patients that needed to find a spine surgeon, so to speak. So it was easy to come in and start quickly. Right now, I'm basically trying to balance seeing patients as well as taking some time off to market myself just to more uh, market myself into various different insurance pools, so to speak, so I don't get to see patients only from one type of insurance, HMO, but also see patients from various type of insurances. Just makes it strategically better in case that HMO decides not to work with our practice anymore. I don't want to be in a situation where, well, I have no other patient sources to come. So I am almost artificially sometimes canceled, not artificial, but basically I'm specifically blocking off times instead of doing some surgery or seeing patients. I try and do at least one afternoon or one morning per week to go out there and market myself to providers, primary care doctors, pain management doctors, neurologists. I have given several talks to patients directly. There are several retirement communities where you come in and basically they do a dinner and you get to talk about procedures, market minimally invasive procedures to them, which even in elderly patients is a great idea because with them, bigger procedures with lots of blood loss is even riskier. So if I can offer that procedure, spine procedure for them in a minimally invasive fashion, that obviously sounds very attractive to them.
Okay, interesting. So are you part of any spine communities other than certification, other than technical
Yes.
stuff? Are you part of any groups?
Yeah.
Okay. What are those groups?
Basically, I'm part of North American Spine Society, the largest spine professional organization in the United States. Obviously, I'm part of that. But I also am part of a Society of Minimally Invasive Spine Surgery, which promotes the minimally invasive spine surgery, and the ISAS, which is International Society of Advancement of Spine Surgery, which used to be Spine Arthroplasty Society, promoting disc replacement versus fusion. So those are the three that I'm most active in, other than just professional medical associations, the state medical society, and the licensure society.
Okay. Okay. So getting away from the business side of things,
Mhm.
how has this transition affected your home life?
It's been busy. We obviously moved. There was a big transition. Our daughter went off to college, so kind of a little bit weird to now have one child just coming over to visit, not really living with you. Our boys are still young; they're 10 and 8, so they're with us. So with them, it was new school. We moved into a new house, so we're still settling in that house. They're still finishing our backyard right now, so things are weird. One of my big hobbies is grilling. I haven't got to grill yet because my backyard is not done yet. So it's been a little challenging. We don't get to rest as much on weekends. It's more running around working, still settling in the house, things like that. So we try to specifically take time, my wife and I, and with kids, and go out there and do fun things, not just work in the house and settle. So we're still in transition with that, but it's getting better and better and easier. We haven't hiked as much as I would have hoped to in the mountains. We keep looking at them, but there's always something to do, and we're postponing. So hopefully in the spring we'll get to do a little bit more of that.
Awesome. So how is adjusting to the new staff in the office?
That's been good. The staff has been great to work with. The adjustment was the staff that I started with. Basically, the way it works in this office, they directly assign certain staff to you, and you work with them all the time. So there are two ladies that work with me. They already had experience in field of medicine, but not really spine. So I'm actually still working on it, and we have decided once weekly to basically set up meetings for them to for me to educate them about spine surgery and how to handle spine patients. So more or less simple questions they can answer to the patients themselves without having to basically go and ask me every time. So still in transition with that, kind of growing, educating them, but obviously getting better, getting easier. We're getting there. But
But
yeah,
it's nice, yeah.
the
You
work
didn't
with
have
the
to
work well is just more educate them on the specifics of spine surgery, which are fairly intricate.
Okay. That's nice. You didn't have to like start from the bottom and hire people and do all
Yeah,
that.
fortunately, they have some experience that obviously makes it easier. And in a lot of ways, they're teaching me because they've already worked in the office. every physician office nowadays has an electronic medical record system, and unfortunately, there are probably hundreds of them, and they're all different. So when you start a new practice, not only you have to just figure out basic logistics of the office, but you have to learn a new computer system. While you're learning it, you're trying to be efficient in the office. So that's where they have been really helping me. When I don't know what button to click, fortunately, they can come and help me. So we're helping each other.
That's good. What are you most proud of in this whole transition?
The fact that I was able to hit the ground running, the concern was obviously I had a very busy, very successful practice in New Hampshire and basically left it all there. And now started everything here. I'm getting fairly busy fairly quickly, better than I thought I will be initially. So that's one thing that's nice. I guess one kind of makes me feel very proud as well as a bragging point. When I left New Hampshire, patients I had a kind of a following of patients that wanted to see me. Some actually came out and saw me here. I actually had one patient who I've done previous surgery on in New Hampshire. He had good outcomes. He needed another spine surgery. He actually flew out here. I did surgery on him in January. He did very well, but basically creating a little bit of a travel medicine. So it's very flattering when somebody is willing to fly all the way across the country to have the surgery done by me because I can offer these minimally invasive procedures instead of finding somebody locally in New Hampshire. Obviously, logistically, it's difficult for that patient, but they were still willing to do that. So that's really nice to kind of know that somebody would be willing to do that just to have surgery by me. Professionally, that's very gratifying.
Wow, yeah, that's quite the commitment. Wow. Okay, so what are you most insecure about in this new area of life?
I guess still learning the landscape, the sort of quote unquote politics of medicine here. I can't say necessarily insecure, more just not knowing. So sometimes afraid of stumbling and saying something to somebody that may politically upset them and may potentially affect my referrals. So trying to be careful on that since I don't quite know the marketing and the political aspect of who refers to him, whom, who has what relationships with him. That gets developed in every market in every place. I kind of knew all of that in New Hampshire. Now I'm still learning that in Vegas. It's a bigger place, so there's a lot more information to learn, a lot more variables, a lot more players, so to speak, in this game.
Mm, so crazy. So where can people follow your journey?
Well, I have the profile on Facebook, drvladimirsinkov.com, and I have a page on LinkedIn. I am much better now at keeping those updated. I post something a lot more regular than I used to, and trying to be even better. I'm trying to do at least once a week of some type of a post, kind of trying to follow your examples. Obviously, I don't post daily like you do, but um, basically trying to keep people updated, letting them know what procedures I offer, what lectures may come up somewhere, things like that.
I love it. Thank you for doing this catch-up interview with me. I'd love to do another one with you, honestly, in a few months,
Sure.
just to hear more. Awesome.
Thank
All
you.
right. Well, thank you for doing this interview. I know you've got to get to work.
I've got to go around on the patient. I'm in a hospital parking lot right now.
Oh, wow. Okay, I won't keep you. Thank you
No,
again,
no problem.
and have a great rest of your day.
You too. Take care. Thank you.
All right. Bye-bye.